Good afternoon, Daktari. Please introduce yourself.
Thank you. Thank you very much. My name is Dr. Wachira Murage, Obstetrician and Gynecologist at the Savannah Hospital, Upper Hill Mara Road, as well as the Savannah Healthcare, Kenyatta Avenue, Pioneer House. Most welcome, viewers. Today we are sharing a very important topic about vaginal discharge.
What is vaginal discharge?
Thank you very much. This is a very, very common presentation of the patients that we see here in the clinic, and indeed even other practitioners experience. Most women come in to complain about a vaginal discharge. They say it's a discharge that's coming from their vagina, that is their private area, and they come to complain because most of the time it's abnormal. But a vaginal discharge is a discharge coming from the vaginal area.
And what can differentiate between normal and abnormal vaginal discharge?
Normal discharge is normally clear around ovulation time. It can look slimy, stretchable. Just before period, it may look brownish. But the moment you start getting blood in the vaginal discharge, it has some smell, because the normal one doesn't have a smell. It may have a smell, maybe pungent smell or rotting smell, or any other smell that is abnormal. If it is a lot, like you can put like 2 pads and it's soaking, and you can say it's excess, that's again is abnormal. So if it has color, if it is bloody, and it has a smell, and it is a lot, then that is not normal vaginal discharge, because the normal one is clear, smellless, and it is stretchable in some cases.
And what can differentiate between normal and abnormal vaginal discharge?
Vaginal discharge can be caused by a variety of things. The commonest, of course, is infection, something like candidiasis. Vaginal thrush is also called that way, or fungal. This is the commonest cause of abnormal vaginal discharge. Of course, other things can be infection at the cervix. It can be due to family planning, like the coil. Any other foreign body can also cause vaginal discharge. Issues to do with the internal part of the uterus, the endometrial cavity, can also cause abnormal vaginal discharge. If you have things like fibroids, which are maybe undergoing some degeneration, you have things like polyps, then it can be a cause of vaginal discharge. But most important, we like ruling out things like cancer of the cervix.
How is diagnosis carried out and treatment available for causes of abnormal vaginal discharge?
So normally the vaginal discharge is started by history taking. You want to understand, how is your vaginal discharge? When is it coming? When did it start? What is the color? And how is the smell? After that, you do other vaginal examination. You first start by inspecting the vaginal cavity. Then you put in something called a speculum. Then you see whether you can see any masses, see the source of the vaginal discharge, and then you do a swab for microscopy, culture, and sensitivity. Should you find a mass, then you can also do histology of the mass. But that discharge is subjected to laboratory testing. Most of the time, he asks for microscopy, culture, and sensitivity. So all that, the history, the color, the way it looks, and then from the lab, then you're able to make a diagnosis of what is causing the vaginal discharge. Of course, some other times, you may consider to do a pelvic ultrasound. If you think that the source is maybe from inside the uterus, you can decide to do a pelvic ultrasound.
Are there any hygiene practices recommended for vaginal health?
Vaginal health is, we normally say, it's sort of natural, and we do not need to go out of our ways to do anything. We normally say the vagina is self-cleansing. It has ways, it is wonderfully made, that it slides, and therefore it keeps bringing out things. That's why there is always some discharge in the normal vagina area. There's always some discharge coming out, because silently, involuntarily, the vagina is moving, and therefore it's clearing whatever is in the vagina. The other thing is that a vagina is anaerobic. It doesn't have oxygen. It is dark, closed, there is no oxygen. So there are rarely any bacteria that can survive there. So vagina is self-cleansing. We are not supposed to do any practices. The moment we try and do things like douching, or putting water or putting some vaginal creams or vaginal washes, we mess up and we even spoil now the normal physiological status of the vaginal self-cleansing. We advocate that people should just clean on the outer part of the vagina. The other area, they just leave for that physiological process to take its effect. If there's a smell, there is something like a discharge coming that you cannot understand, then you go to the doctor who will examine, as we have alluded, and be able to tell if there is a problem.
Are there common misconceptions you would like to correct?
Yes, I would want to say that the vagina is not dirty, because most ladies believe that the vagina is dirty. Most people believe that the vagina is smelling. I would want to tell people that if the vagina is sick, if the discharge is abnormal, you always tell. You don't need to make an effort. I've seen so many clients coming to tell me, Daktari, anytime I move into an office, people run away from me. Anytime I go near my friends, they start asking what is smelling. It's already in their mind that they are dirty. There's some smell. But I would want to say, if there's some smell coming there, it should be sorted out. Otherwise, there's no smell. The vagina is a healthy, clean organ.
Is there differences in discharges for adolescents, pregnant women, and postmenopausal women?
And not much. Of course, during pregnancy, the discharge may vary a lot. It may be more. It may be also a bit slimy. They tend to have more candidiasis, so it could be heavy, cream white, and itchy. As you get to menopause, then the vagina tends to be a bit dry. The vagina is, the discharge, because the hormones, the estrogens, are going down, and therefore they normally get a bit dry. Otherwise, there's no much difference between the three groups. It's only that in pregnancy it's more, and in premenopause or menopause, the vaginal discharge is much less, because that's why they complain of vaginal dryness, because the estrogen is really, really low at that particular time.
What are your thoughts on oral sex?
Okay, I know that's a very, very hot topic about oral sex. What I can say or give my thoughts is that oral sex can make people pass infections to each other. It also brings infection to the oral, to the mouth, or the one doing oral sex, and of course even things like HIV, HPV can also come from oral sex. So oral sex is discouraged from the medical point of view, to say the least, because of the easiness of communicating infections.
Are there any home remedies or over-the-counter remedies for abnormal vaginal discharge?
Yes, people tend to think, it's in literature, it's not well confirmed, that if they take things like cranberry, if they take things like yogurt, and then they avoid pastries, it helps to reduce the abnormal discharge, particularly the fungal infection. Other people do other things. They put the yogurt into the vaginal cavity. Others use I don't know whether it's hibiscus. All sorts of things women have tried to do that, but all are supposed to be mentioned to be condemned because they don't help. But limiting carbohydrates, pastries, those ones may help in a way, and taking the yogurt by mouth, not putting in the vagina. It tends to help control the fungal. But the other discharges, those ones have to be investigated. The cause is known. If there are bacterial infection, if it is fungal, if it is maybe gonorrhea, just in case, then those ones to be treated adequately.
Any conclusive advice on abnormal vaginal discharge cases?
Yes, what I would say is that should you find that the discharge is out of what you're used to, and for example, it has blood in it, it has a foul smell, it is excessive, it's associated with fever generally, and pelvic pain, you must see the doctor. Okay, don't get treatment, don't get over-the-counter treatment, just go. Particularly, you have not done a pap smear and you're sexually active. You have not done a pap smear over time. You must see the doctor to examine that discharge, take it to the lab. If you have not done a pap smear, then do a pap smear just to ensure that that abnormal discharge is not due to an ailment, for example, cancer and other, maybe even sexually transmitted infections. So it is important to have it checked instead of assuming that it is maybe normal, it's part of your cycle, because it can end up being something that needs active and immediate treatment.
Any words of advice?
Yes, a vaginal discharge is a very common presentation in the women. It's the commonest presentation that we see in women coming for consultation to the gynae offices, which is good. And we all urge that should you get a discharge that is out of what you're used to, do not ignore it. All right. Secondly, let us remember that the vagina is a healthy organ. It is not a dirty organ, it's a healthy organ. It has its own mechanism of self-cleansing. Let us not start putting things inside. Let us not assume that we are smelling. There's a usual smell that everybody gets towards the end of the day because we all sweat, but that is within ourselves. Any smell that can come out of you, and you'll also be the first one to perceive it, then that can be abnormal. Otherwise, those other smells in the course of the day, those ones are normal. So let's not condemn our vagina and say it's dirty. We need to clean. We put water, you put salt, you put betadine, you put all sorts of things. Those things help the natural health of the vagina, and that is now where the infections, the smells come. Thank you. I appreciate it. Thank you.